you're not Mr. Potato Head, where I can just take a piece off and put another piece on.
Some trends I just have to go as fast as possible.
You do Botox? Oh my God. Why would you do that?
You can't fix that.
Surgery is not a solution for everything.
Hello, everyone, and welcome to Get Under My Skin, where we're going to dive deep and transform the world of aesthetics. I'm your host, Katya, and I'm a licensed esthetician with over 6 years of experience in medical aesthetics. Today, I'm thrilled to be joined by Dr. Lorenz Iteld, a distinguished plastic surgeon with over 2 decades of experience in aesthetic and reconstructive surgery. Dr. Iteld is a founder and a medical director at Iteld Plastic Surgery and serves as the chief of plastic surgery and advocate Illinois Masonic Medical Center. Known for his personalized approach, Dr. Iteld specializes in a wide range of procedures from facelift to body contouring and beyond. Welcome, Dr. Iteld.
Thank you for having me. Pleasure to be here with you.
Thank you. To kick things off, how about we start with some rapid fire questions to get to know you, and we'll just have fun with that.
Sounds great.
All right, perfect. So let's get started. How many surgeries do you perform in a week?
Typically about 6 to 8 major procedures and then about 2 to 4 minor procedures in the office.
Okay, perfect. What's more challenging, placing implants or removing them?
In general, they're about the same, and they're usually pretty routine. I think the key is the planning of the surgery.
Mm-hmm.
If there's no unexpected surprises, both are about the same. Pretty routine, straightforward.
Okay, that sounds pretty good. Good to know. Can people get addicted to plastic surgery?
Absolutely, but that tends to be outliers. The majority of people come in for 1, 2, maybe 3 concerns that they want to address. You can see distortions and stuff start coming in, but that's really rare. And one of our jobs is to pick up on the clues of somebody who's starting to lose sight of the proverbial forest for the trees.
Mm-hmm.
But the vast majority of our patients are amazing men and women who just want to tweak something.
A little touch.
A little touch.
Yeah, that's perfect. Have you undergone any surgery procedures yourself?
So I have.
Okay.
I think
that's when it's getting spicy.
Yeah, now we're getting a little spicy. That's okay. That's okay. I've dabbled with most of our devices that we have in the office because I think it's important for me to know what my patients are going to experience. I have not had any cosmetic surgeries done. I had my airway opened up with a septoplasty about 20 years ago. Best thing I've ever done.
I did that recently too.
You did it?
Yes,
so you know.
It
changes your life.
It does, let me tell you.
But yeah, I mean, I love playing with our devices, and I always have ever since we've gotten them. So I'm usually patient 1 when we get something in.
I agree with that because I always tell to my clients, anything that I'm doing, I've tested on myself. Otherwise, I wouldn't be doing it.
Absolutely.
That's perfect. So the next one, does plastic surgery affect patients' mental health?
Absolutely. And that's true not just in the cosmetic arena, but there's a lot of validated data in the reconstructive space as well. The most common thing we see is just an improvement in confidence. Mm-hmm. Wherever we start from, we have something that bothers us. There's something that we fight against. There's something that we try to mask with our clothing or makes it hard for us to present ourselves in the way we see ourselves. And being able to tweak that really gives somebody an amazing ability to express themselves the way that they feel on the inside. And it's tremendous.
Amazing. How about what's most challenging surgery you've had?
Most challenging. I think in general, the hardest procedure that we do would probably be rhinoplasty, nose jobs, for a lot of reasons. And number one is it's right in the middle of your face.
Yeah.
And any little asymmetry that may develop, and nobody has a perfect nose, you're going to see. Mm-hmm. And people can fixate on it. And so that can really make it challenging for people. It's also an operation where You can do a perfect operation, but depending on how something heals and how things evolve over time is going to change. And while we expect things like our face to change as we age, or the shape of our midsection to change 5, 10, 15 years, we don't expect that in our nose for some reason, but the nose does change. So I think that that's just the hardest operation that we have.
Mhm.
And even when you do it perfectly, it can still be better.
Yeah,
So it's a hard one.
that's perfectionist point
It
of
is.
that.
It is.
Yeah. Let's see. What's the most popular myth that you heard about the plastic surgery?
Oh, there are a couple of them. Number one, I think, is the whole breast implants have to be replaced every 10 years.
Yes.
That
I think I
is,
had that question too.
yeah. I mean, that is out there. I know where it came from,
Mhm.
and it's old data. The companies used to manufacture implants we used to warranty implants for 10 years against rupture. This is back when we used saline implants. And then around the same time, we're talking about 20, 25 years ago, data came out that showed that for all cause revision surgery on the breast, it was about 50% at 10 years. So you put those two data points together, and so people assumed every 10 years. But you don't. As long as you're happy with your implants, you're happy with the shape of your breast and so on, you can keep your implants indefinitely. But that's a myth that just won't die.
Mhm.
I think the other one is a little bit less of a myth and more of a trend. And I know you want to talk about trends later. It's this idea that we can do anything to anyone.
Mhm.
And I tell my patients all the time, you're not Mr. Potato Head, where I can just take a piece off and put another piece on. We
Oh, in
have,
the perfect world, right?
it would be great, wouldn't it? But we live in a world where we have to work with people's natural starting points.
Mhm.
And that can limit where we are going and what we can achieve. And social media has not been helpful with that. It's been wonderful for other things, but it hasn't been helpful in people's expectations. And so I think that's the other one, that anything can be accomplished. And so I think those are the two myths that I need to kind of keep working towards.
Okay, that sounds good. Let's see. What are 3 words do you hear most often from your patients after surgeries? I think I know that answer, but I'll let you.
Yeah. Probably that was easy. Um, Patients come in expecting their recoveries to be really, really tough
Mhm.
and a lot of pain and prolonged. It doesn't have to be. And one of the things I pride myself on is the recovery process.
Mhm.
And the way we do it with our non-narcotic recovery, and we use, techniques. I know we were going to talk about that in more detail. Um, People who know others who've had the same surgeries are like, why were they in pain for a week? Why were they out of work for 2 weeks when I'm 2 days out and I feel like $1,000,000? So that's what I hear all the time. More than anything else, that was easy.
Yes. And I can totally agree to that. And that's the thing that I tell most of my clients that ask for referrals. And I say, this is the most easiest surgery that I ever had. That's why people get addicted to it, because you just came out, you look beautiful, and a couple of days later, you're fine. I think I took a Tylenol only the first day, and that was it.
Yeah.
It's amazing. It's
Yeah.
amazing.
It has totally transformed the experience.
Mhm.
And I think that has been so rewarding. And look, I've been using these techniques for 15 years. And I think I can honestly say I don't want to say perfected because I'm always still fussing with it,
Mhm.
but essentially gotten to where we are for the past 10 years. And I'm still amazed at it. I'm still amazed when patients come in the next day after a full mommy makeover and they're like, yeah, I'm a little sore, but we went out and had breakfast this morning and I feel pretty good. And by 1 week, it's like, can I please go back to the gym? Please, 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 please.
I was
It's
guilty of
pretty
that.
incredible.
Yeah. Okay. Well, the last one that I have for us would be, what would be your title of autobiography as a plastic surgeon?
Oh, wow. Well, personally, I'd rather it be a biography because I hate writing. So let it be someone else doing it. Um, Probably something along the lines of better each time.
Mm-hmm.
Um, Plastic surgery is a journey. As a provider, it's a journey. Um, we learn from our misses more than we learn from our successes. And I think one of the things that my mentors imbued on me was embrace your misses. Embrace when you don't do something perfect
Mm-hmm.
because it will make you reflect on it, figure out how you can do it better, and then the next time it will be. And then as you continue in your experience, more often you're going to have high levels of success rather than just doing an okay job. So, in some ways, that is the hardest part of what we do because when you're trained the way that my mentors trained me, I never look at something and say, that was perfect. I always look at something and say, okay, yeah, I could have done this a little better. So that's why. That's how I look at it. So, better
There's
each
always
time. Better
each
each time
time.
would
I
be
like
the way
that.
I look at it.
Well, most definitely. And I think it's a beautiful way to look at it. And the sky's the limit. There's always a little space for the progression. I love that. Well, since we warmed up a little bit, let's dive deep into the hot topics
All
of
right.
plastic surgery and beauty industry. Let's see. Well, since we kind of touched base on the trends and cosmetics, I have a question for you. What are the latest trends in cosmetic surgery and how do you see them evolving in the next decade?
Yeah. You know, let's separate two things. Let's
Mm-hmm.
separate trend and fad.
Mm-hmm.
Okay. So the trend that I think we're seeing is for a more natural appearance and natural results. We went through with, especially with like breast surgery, breast augmentation, back in the 90s, it was all about how big can you go? And that has been definitely trending to a much more natural appearance now. And that's what I hear the most with breast surgery is I want a more natural appearance. And we went through this phase with body of some of these extreme cinched waists and massive buttocks and etched abdomens. And I'm seeing less of that now. I'm still seeing shape, but I'm seeing athletic shape. And for faces and for noses, same thing. I want to look refreshed. I want to look like myself. I don't want people to know that I did something. And so I think the trend of natural versus extreme has been definitely coming up. And I see that just progressing over the next, 5 to 10 years. Fads are a whole different ballgame. And the cycle of a fad has really been changing a lot. And social media has absolutely accelerated that. I mean, I have literally seen fads come and go within a season or two. We went through this,
Really?
the fox eyes, right?
Yeah.
I mean,
Yeah.
that literally had the lifespan of a carton of milk. I mean, I had patients coming in for about 2 weeks
Uh-huh.
asking about it nonstop, and then I haven't heard of it since. So there's always going to be fads.
Yeah.
And social media drives it. But fortunately, I think that those are, again, if you just hold your breath and you tell patients, you know what, I'm a little busy right now. We can get you in next month. They'll be
It's
gone.
good.
They'll be gone. Yeah.
That's a good tip to know. I completely agree with that it consistently changes and some trends I just have to go as fast as possible, including the fox eyes.
So glad that one is gone.
And natural look as well. That's something I really like that I've seen in social media, people advising take a picture on your birthday every year.
Hmm.
And then when you do decided to do something, show them your picture and they provider will try to recreate that natural look that you had. Not somebody else, not Megan Fox, not Kim Kardashian, you. And that's I think the biggest tip that I feel like everybody needs to know because we want to just embrace your natural beauty.
That's cut right there. Stop. Frame that. That's the answer. That is the key message.
I love that. Let's see. So can we please talk about what Daddy Do-Over and the Mommy Makeover are and their growing popularity?
Sure. So mommy makeover is probably at least a 20-year-old term at this point. It originated as a way to describe the combined procedures that we would see in, I hate to use the term middle-aged women or after childbearing to help reverse some of the normal changes that we see, typically abdominal and breast changes. So historically, it would be things like a tummy tuck with a breast lift or with a breast augmentation. It's expanded from there, and now it really means any combination procedure, typically in that demographic group. It might be fat grafting now, but historically it was abdomen and breast. And honestly, I think it's a good term. And for us, I encourage my patients, if you're thinking about doing more than one thing, as long as it's safe, do it at once because it's one recovery. It's one downtime. And especially when you talk about a mommy makeover, well, you're a mommy, which means you have
limited amount of time.
You've got littles, right? You've got littles and you've got professional responsibilities, and we don't want you to have to take off twice. So I think that that's really valuable to do it all at once. Daddy Do-Over is a nice play on that. And, daddies tend to, lose their, let's call it boyish figures for different reasons, family responsibilities, professional responsibilities, and ultimately declining testosterone levels as we get older. So it's a nice way to put it together. And for men, it also is very frequently the same areas. It's chest and body contouring. So it's been a really fun way to bring the men in. And men are a growing proportion of all aesthetic treatments. I'm sure you are seeing more men now than you did, in the past. So we like to be inclusive around here.
I completely agree with that. I feel like the men in general are more interested in now keeping up with the aesthetics and taking care of themselves, which I really enjoy that trend at this point. Especially, I see more men just in general aesthetic treatments for the skincare, hair care. That's something is sensitive subject for a lot of men, the hair loss. I think it's one of the latest ones. But yeah, I definitely see more men in the industry being interested in the industry.
Yeah, I mean, look, frankly, it's a win if you can get a guy to put sunscreen on. But
yes, that one.
But if you can get a little bit of basic skincare, it goes so
further.
long.
Yeah, absolutely. All right. Well, next topic, I want to touch base on the ethic of plastic surgery. So how do you navigate the ethical consideration in plastic surgery, especially considering body image and patient expectation?
Yeah, I mean, this is the key of, I think, just being an honest person. It's very easy to fall into the trap of promising a result or just saying yes all the time. That's not always the right answer. When I meet with a patient, there has to be an understanding of expectations. What do you expect from me? What do I expect from you? Are we on the same page? Can I deliver what you want? And I don't say yes all the time. In fact, sometimes it's frustrating. I'll say no more often than maybe I even want to. But I think that is an essential part of what we do. And, while you have outliers who have true issues, body dysmorphia, uncontrolled mental health issues, who are not good candidates for surgery, you have some patients who you just know are not going to work out. They're not going to be happy. So first and foremost, we are working with people. We are manipulating people's bodies. You only have one of those. So you have to be able to suspend chasing the almighty dollar and just keeping your OR schedule busy and just look at each person as an individual And as long as you treat each person the way that you would want to be treated or you would want your family member treated, you're going to be true to yourself and true to them. And then the ethics are easy.
That's a perfect answer. And as I always say, under promise and over deliver.
Absolutely.
Let's see. So, how about we now talk about the social media, which we already talked a little before. How has social media influenced people's perception and desires regarding plastic surgery?
So social media has been a huge boom for plastic surgery. It has made information more accessible, more digestible. It has made it easier for people to find surgeons. And I think more importantly, I'm old enough to remember, it's brought plastic surgery out of the dark. It used to be your little secret that you had something done. Now it's, why aren't you? I mean, I remember when Botox came out 25 years ago, and people were like, "You do Botox? Oh my God, why would you do that?" And you would get
Dirty
Botox.
little secret.
Yeah, you would get Botox shamed. Now people still get Botox shamed, but it's, why aren't you doing it? All the cool kids are. And so I think social media has really brought it out. There's a dark side to that, though, and it goes back to expectations. We have to remember that when you go on social media or on websites and surgeons are presenting their results, typically they're showing their 1, 2, or 5% best outcomes. They're not typically showing their average results. Some people do. And so patient expectations are, I'm going to get that result. And they're not always. And they're not as accepting of the fact that there might be complications. There might be prolonged healing. There may be need for revisions. And for some reason, while I respect the botched doctors a lot, and they've really done a tremendous job at educating, the term botched is now been co-opted by patients to think any revision means that they were botched.
Mm-hmm.
And I think that Dr. Dubrow has really said, no, that's not the case. There is truly a big difference, but we have to be aware of that. And so, like anything else with media consumption nowadays, we need to be more educated about it, whether it's the news or social media with plastic surgery. And we need to create a better literacy for patients. And then it could be a force for good. So I think that it's got this, dark side and light side. It's kind of like, the force in Star Wars.
Yeah.
But all in all, it has been wonderful for us and wonderful for society's knowledge about what we do.
Absolutely. I feel like it's a love or hate relationship with social media and consistent. Now, I feel like nowadays, as a business, as a creator, you cannot go without a social media. But there's a ton of information. There's also a ton of information that is misleading. But there's also a ton of valid information. For example, Real Self website. That's how I found you one day. And I think it's a fantastic platform because you can see the true results, not only what provider posted, but also patients that undergone surgeries, their process, the expectations, and real results from real people. And you need to pick a provider that fits your needs. Because what I like, she might not like, or he might not like. Everybody has their own perspectives and the vision, what they want. So that's why it's valuable, accessibility to information, the social media, but we always have to filter that.
Agree with you 100%.
Beautiful. So let's see. How about we talk now about innovations in technologies in our beauty industry? Can you discuss any technologies and techniques that are changing the field of plastic surgery?
I think they're constantly evolving, and it's been wonderful to watch. Things like less invasive options for fat reduction and skin tightening have definitely evolved, and we think I think the most recent one have been radio frequency energy and the way that we're using it both under the skin and on the skin surface, and that's been pretty remarkable. Um, that's probably the biggest one in the past 10 years in my mind. I don't know what the future holds. I mean, it's going to keep getting better and better, and we'll be able to do more and more things non-surgically. There's always going to be a role for surgery. Um, but yeah, I mean, we keep seeing more and more fillers and different types, and the toxins are getting better. Skincare stuff is getting so much better than it used to be. It's really interesting. I think the future is really bright for the aesthetic space, as these technologies continue to evolve.
Most definitely. What is your, like, let's say, favorite non-surgical technology for like fat grafting or volume restoration in general?
So I think the use of fat has really been a big boom for us. It's not new.
Hmm.
Some people, especially if again, let's go back to social media.
Yeah.
All of a sudden we're talking about fat grafting to the breast and to the face, and BBLs obviously for the buttock has been around for a little spell. But the reality is the very first fat graft was done in, hold me if I'm wrong, 1893 by a surgeon named Cerny. I'm probably pronouncing it wrong. You could probably pronounce it better.
Journey.
Who used a lipoma, a fatty tumor from, I believe, a woman's back, and put it in her breast for breast asymmetry. And it, didn't do very well. It was too big. But the reality is
the first try.
First shot. But the reality is using one's own fat is not new. But I think as we've gone to this trend for natural results, it's becoming more and more appealing and more common, and we're getting better at it. And it's not as a standalone. I really like it as part of other things. And so using it as part of a body contouring, for example, it's wonderful. So that has been a big trend in the past 10 to 15 years, and I do see it accelerating. We've gotten a lot better at safety for it, especially for buttocks.
Yeah, that's the thing. Because I've heard that is one of the most dangerous surgical procedures.
And here's the irony. It is, when done right, fat transfer to the buttock or a BBL is no more risky than an abdominoplasty. And that study has been done. If we go, we're going to dive into the weeds for a second about it.
Yeah.
The problem with fat grafting to the buttock was when we started doing them, we did them without knowing the risks. So we would inject the fat, at least in part, into the muscle. Makes sense. Great place to put it. You can put a lot in, big old booty, right? But the problem is, what could be better than a big old juicy booty? But the problem was that you can also cause damage to the veins in the area that can then suck the fat in. It can go to the lungs, and people died. And a couple of our colleagues in Miami should probably get the Nobel Prize for this. I think that they truly deserve it. Dr. Onelio Garcia and Pat Pasmino worked with the medical examiner and was at the autopsies of a couple of patients, and they figured out what was being done wrong. And with that, we now have standards that you should only inject the fat above the muscle into the fat layer itself. And with that, the risk is essentially zero. And so it is an incredibly safe operation. And it's a wonderful operation when done properly. When done properly. So, that goes to, researching who's doing your surgery and the importance of that. But it is a great procedure, and it is a very safe operation when done right.
That's a good note, and I feel like it has to be highlighted many, many times, because I've seen a lot of people going for, more budget-friendly options, and there are some questionable practices that I feel like just stamping procedures, and it ruins the reputation of certain surgeries, procedures, or industry in general. So that's why I always say, make sure this is your body, the only body that you have. Don't try to go on the Black Friday and, take your half off of it.
Yeah, absolutely.
Beautiful. Well, thank you for answering that. I think it's a really important subject that needs to be talked more. Let's see. Next, let's talk about some patient stories. Could you share a particularly challenging or rewarding case you've encountered?
It's really hard to pick one. Um, wow. There's one that stands out to me. It was very, very early in my career. It's when I was still in Miami. And patient's mother was a patient of ours. I used to do some Botox on her. And she brought her 17-year-old daughter to me for a breast reduction. Beautiful, smart, athletic, very charming young woman who was just top heavy. She was a very slight build, but her breasts were just out of proportion. And we did a breast reduction on her. And everything went great. She was happy. And mom came in a few months later for some Botox. And it happened to be in between when I would have seen the daughter for her follow-up. And I asked the mother, how's she doing? And her mother said, I don't know what you did to her, but she's a total bitch. And I just looked at mom and I said, you are so welcome. Because she was so self-conscious about her breasts and feeling insecure about it that she was stifling herself. Yeah. And now that she had the body that she wanted, she was, outgoing and gregarious and playful and a little bit. She was a teenager. She was being difficult. And it was such a wonderful thing to hear.
Yeah.
And, of course, mom said it tongue in cheek, but it's 20 plus years later, that still sticks in my mind. I remember it like it was yesterday.
That's fantastic. Honestly, I see nothing wrong with that. I feel like everybody needs to have that little B in order, to succeed in general. But I can totally relate. I've heard something similar from people saying to me, and I think it's just to build the confidence. It's all about the confidence. It's all about how you, what perception you have about yourself, and especially, I'll talk a little about me, I guess. When I had before the kids, I was perfectly happy with my body. But then you have kids, it's not only a life-changing experience, you can never go back from that, but you're exhausted and you have this flaw. I wouldn't say flaws, but something that changed tremendously. And you work out and you take care of yourself, but certain things you can't fix that, and being used to feeling all confident, wearing what you want and feeling great about it, from going to completely opposite to that and just cannot get over it. And once it's nothing wrong if you like it and it's perfect and you accept yourself as you are, it's fantastic. But if that's something you continue thinking about it, if something you're self-conscious about it, then it's nothing wrong to get it done and get it fixed.
Yeah. And you said something there that I think is really important that we can dive into a little bit, which is that you said you work out, you take care of yourself, you eat healthy, but there's still something that's resistant. Surgery is not a solution for everything, especially when we talk about body. Mm-hmm. And some people think that they can, take the surgical shortcut and not make lifestyle changes and have this massive transformation and have 50 pounds of excess weight removed just by going and getting liposuction in their tummy tuck and whatever. And it doesn't. There are things that surgery can address that lifestyle changes cannot. And then there are things that lifestyle changes can address that surgery can't. It's complementary.
Absolutely.
And I think we've really started to come around to that. Let's be honest, there are certain things in life that are incredibly difficult. Smoking cessation and weight loss. Mm-hmm. They are two of the things that every New Year's resolution you have, and most people are making that resolution year after year after year. And we've gotten better at it. And we have this whole new class of medications, the Ozempic, Wegovy family, the GLP-1s, that have really helped a lot of people lose weight that they hadn't been able to before, usually because of metabolic reasons. And it's created a whole new opportunity for us, which has been, wonderful. But some of those patients used to come to us ahead of time and said, "Look, I've gained 60 pounds, and I want you to get me back to my size 6." I'm like, I can't, you know, and so there are limits.
Yeah.
But having that balance, that healthy lifestyle, and then using surgical or non-surgical techniques to clean up the rest,
hmm
that's the sweet spot.
I completely agree. I literally recently had a conversation with my clients, and obviously I get asked a lot, oh, I'm considering exempting or I'm considering the plastic surgery to do certain things. And I always say the same thing. You have to make the lifestyle changes prior you're going to that. It's the same thing as, you're going to the gym, you pay for the trainer, you spend the time and effort and energy doing it, but after workout, you decided to reward yourself with some Dunkin' Donuts, let's say,
Absolutely.
So it's all about getting there yourself, getting the base of it. And the surgical procedures or non-surgical procedures will implement your results. And that's the key to get the most out of it.
Absolutely.
Well, I'm glad we agree on that. All right. So since we talked about non-surgical procedures, what are advantages to non-surgical procedures have over surgical ones for maintaining overall appearance, and can they replace surgeries altogether?
So can they replace? Yes and no. Aesthetic offerings in 2024 are very different than 1974.
Mhm.
So, when I was a child, it was surgery or nothing. And as things have evolved, and the first major transformation were the introduction of the neurotoxins or Botox back in the 90s. And it has changed a lot of things. I mean, how we don't do brow lifts very much anymore. Now you just treat it with Botox. Laser resurfacing for the face has definitely changed things. And then, Cool Sculpt was the first non-invasive or minimally invasive fat reduction technique. Before then, that never existed. So we don't have non-surgical solutions for everything. I don't know that we ever will, but over time we're getting more and more. So, what are the advantages of it, you asked? Well, number one is not everybody is progressed enough in their either aging or body changes that surgery is needed.
Mhm.
We have what I like to call tweeners, patients who are in between, where you're starting to see early facial aging or a little bit of fat accumulation or a little bit of skin laxity that you want to address. You don't need surgery for that. We have things that have now come in. Whereas again, 1974, you were getting a facelift, you were getting a tummy tuck. Now you don't need to. The other advantage is less downtime. There is recovery from surgery. Even if you don't have a lot of pain and I can get you back to work in 48 hours or less, there's still downtime. You can't go to the gym and this and that. Non-surgical, on average, the downtime is going to be less. So those advantages are there. But I think more important than that, than replacing one versus the other, it's how do they work together? We were talking about skincare. It's synergistic with resurfacing, with RF energy, with surgical rejuvenation, that non-surgical things complement surgery. So even if you are somebody who would benefit from surgery and you choose to do it, it doesn't mean you can't take it to that next level by using non-surgical adjuncts at the same time. And that, to me, is where a 1 + 1 = 3.
Mhm.
It's definitely additive and works tremendously well at improving the end result beyond what you could do alone with either one.
Beautiful answer. And I always say that's the same thing what we just said about lifestyle changes. Same thing about the skin quality. You can get the surgery done, you can tighten your skin, but if you continue improving the skin elasticity, just taking care of good skincare routine at home, it will last you way longer.
Right.
Yeah.
We're going to age.
Yeah.
We have not figured out how to stop aging.
Yeah.
Not
yet.
Not yet. We haven't figured that out. And if somebody chooses to have a surgical procedure, you're making an investment in time, and an investment in finance. And you want that to last as long as possible. You can go out and buy a beautiful handbag. And if you take it out in the rain and put it on the floor, it's going to look pretty beaten up pretty quickly. But if you put a weather treatment on it, and when you sit down, you put it on your chair or on a stool, and you treat it nicely, it's going to look beautiful for years and years to come. Now, eventually, is that leather or that waxed canvas going to age? Of course it will. But it's going to become vintage, not beaten up. Your body's the same way. And that, to me, is where it is so important not to just say, I had my surgery and I'm done. You need to take care of it. And if it's your face, it means pairing up with a wonderful skincare professional. If it's your body, it's maintaining that gym membership and that nutritional monitoring. Keep it going as long as you can.
That's a beautiful, top-notch answer. I couldn't say better. I will remember that example with the bag. Because, I feel like every provider in the beauty industry get asked that a lot. Well, how long is it going to last?
Yeah.
I feel like it's one of the most common questions. And it's really hard to say, but I always say it's how long you're going to keep taking care of that. Right. Yeah. So, we'll move to the next one then. You can end on a great note.
You can make that handbag analogy yours.
Oh, I will definitely do so. I apologize in advance.
You're welcome to steal it.
Thank you. Okay, so let's see. What are some common misconceptions about the plastic surgery that you would like to address?
Well, I think we've kind of touched on some of them already. Yeah. Number one is nothing is forever. And results don't stay static. I wish they could. I wish I could freeze time. But time will pass and results will change. And even if you do everything right, we're still going to see things evolve over time. Number two is that we can do anything. I think we've really discussed that you can bring in a picture of some social media influencer that you saw and you can walk out looking like him or her. It doesn't exist. I am old enough to remember when Jennifer Aniston got the Friends haircut in the 90s. I know I'm dating myself, but when that haircut came out, I don't want to say every woman, but a lot of women went to their hairstylist. I want her haircut. I want that haircut, right? And it was the Jennifer Bob, and it looked
known as Karen. Right?
No, it looked great on some people, and it didn't look great on others.
Yeah.
So I think that's another one. And I think the other thing, a misconception I'd really like to dismiss is science fact from social media science, and pick your, I don't want to say conspiracy, but pick your surgical myth. Well, I read, my friend told me, but I heard. Okay, that's nice, but can we talk about science for once? Yeah. Because they are not the same thing. And you mentioned before, the power of the internet is wonderful, but it's unfiltered and you can say anything you want. Truth is what you believe. And we need to get back to believing what the science tells us. And if science doesn't tell us something, we need to do research to figure out the answer to that. Those to me would be the most important things that we can, help dispel.
Absolutely. I stand by with every word you said. Okay. So how about now we're talking about how we personalize the procedure. How do you tailor surgeries to individual needs and ensure natural looking results? Could you also elaborate on the narcotic-free recovery approach?
Sure. So individualization. Um, I think most plastic surgeons take great pride in that. And, each person is a new project to
Mhm.
work on. And, you mentioned before, places that just pump out results. I'm not going to talk about them. When you go in and you meet a coordinator and the first time you meet the surgeon is 3 minutes before the surgery starts. It's not what we do. It's not who we are.
It hurts my heart to
Yeah.
listen to that.
But
Yes.
it's all over the
Yeah,
place.
yeah, absolutely.
So for me, it starts with listening to the patient. It's sitting down with the patient and trying to ask probing questions to get into his or her mind as to what they want. Now, that's important for two reasons. If I don't know where we're going, I can't get us there. And number two, are we realistic? Are our expectations attainable? Assuming they're attainable. To individualize, you have to figure out where you're starting and where you're ending. I rarely do the same operation on two people because no two people are exactly the same. I just today saw a pair of twins who I did two different operations on. It was on their breast. And now they look like twins. They started out for very different reasons looking different.
Mm-hmm.
And, I had to listen to them. What did each one want to accomplish? And they're, happy as clams. That is the key thing, is listening. So for example, when we do a breast augmentation, woman comes in, I want to be in a C cup, a D cup, whatever.
Mm-hmm.
Those letters mean nothing. Okay. To my women who are listening, I will guarantee you that if you go to different stores, you're going to fit different bras. Because cup sizing in theory is supposed to mean something, and in reality it doesn't. Okay. Victoria's Secret, their sizes are way different than everybody else's because it makes you feel good.
Yeah.
Okay. It's not just bras, by the way. Sneakers are the same way. Do you ever look at the size of your Nike or your New Balance sneakers compared to your fancy dress shoes? They're at least a size different,
true.
right?
Yeah.
Because it's a hero thing. It makes you feel good. Okay. So we don't want to go off of that. So we want to sit and talk to a woman and say, okay, let's see where we're starting from. And let's use sizers. So we use these silicone molds. And, again, anyone who's not well endowed to start with has probably bought the little silicone stuffers and you've put them in, right? And so
part of it.
Right, exactly. You know what it's about. And we listen to what you want because every woman knows what she wants to look like, right? So all we have to do is listen. And then based on that, we can do measurements and figure out, and then we have a 3D simulator that lets us show you roughly what you're going to look like. By doing that, we can truly customize for each woman what we're going to do. Do we need different size implants for different breasts? What little asymmetries are still going to be there? Because there are going to be some. But we can really drill down what we're doing. And by doing that, your revision rate goes to, 1 percentage point, maybe 2. And that is been incredibly effective. Now, not every procedure do we have technology that we can give a visualization, but we can do things like pinch and pull and tug and give somebody a framework to work from. And if you listen to them and you watch their body language, I like that, I don't like that. And by the time you go to the OR, all you got to do is execute.
Mm-hmm.
Then it's fun. There's no guesswork involved. So I think that is the key thing to the personalization, the individualization, and getting great results. Narcotic-free. So this has been one of those things that's been challenging for me to be able to explain to patients. Because I might be an okay surgeon. I'm a terrible marketer. I need to hire a marketing company for this. So I've always called it narcotic-free recovery because that's what it is. It's a good descriptor. The concept, though, is it's really a pain prevention strategy. So traditionally in medicine, we do something to somebody, and as a surgeon, it usually involves a knife. And we cause an injury, and you get an owie, and we treat it with pain medicine, right? Well, is that the best way to do it? I would argue no. Where did this whole idea come from? When I was a medical student, I had my wisdom teeth removed. And I remember getting home after the surgery, and I was in pain. My mouth
What?
hurt. You've
Oh,
had it
yeah.
done. Okay, so you know. So I got home and I took, one Vicodin, two Vicodin, whatever, and I was sick to my stomach.
Mhm.
I threw up. I'm like, I can't do this again. This is worse than the pain. And so I sat for a minute with my medical school roommate, Adam, and I was like, dude, I need something different. And he said, well, what do you feel? And I said, there's a lot of throbbing, and it feels swollen, and it aches. And saying those words meant a lot to me because it said, how do I treat throbbing, aching, and soreness? At the time, I was a marathon runner. I experienced that all the time. So I took Advil and I took some Tylenol. And guess what? It felt better than the Vicodin did. And so I extrapolated that moving forward of treating the descriptors of pain rather than just treating pain. Now, there are times when you have sharp stabbing pain, and that you have to use narcotics for. But then it evolved to, how do I decrease the sharp stabbing pain? And we started using things called pain pumps, which were indwelling catheters that would infuse numbing medicine to the surgical site for up to 72 hours. And all of a sudden I realized, holy crap, patients didn't have a lot of pain after surgery. And then we started evolving to nerve blocks using a long-acting medication called Exparel, which lasts for 2 to 3 days. Now you don't have this dangling pump thing. And we started to realize that after 2 to 3 days, you don't really develop sharp pain. You're through that initial injury cycle. So, we've all had boo-boos in our lives, right? And some of us had significant boo-boos in our lives.
Right.
But unless you have like an unreduced bony fracture, after a day or two, the sharp pain goes away.
Wait.
Even when we had our wisdom teeth out, right? The first day or two are the bad ones. And after that, it's not so bad anymore. And so that's where the philosophy came from. And it was using other technologies to decrease that sharp pain response. Now you don't need the narcotics. You can treat things like throbbing, aching, and soreness with non-narcotic options. Well, all of a sudden, your recovery is really easy because you're not sick.
Yeah.
You're not sedated. And now I have not needed to give patients from elective surgery narcotics in 10 years.
That's amazing.
At all. It's pretty remarkable the way it changes. And, like I said before, it still amazes me. Now, it's so normal to me. My staff, who have been there for 2, 3, 4 years, that's all they've ever known. But for me, where I've been in practice for over 20 years, I remember when people would come in after a tummy tuck hunched over.
Yeah.
Or breast augmentation and their arms are cinched across their chest. Now people are coming in and their hair is up and their Starbucks is in their hand and
they're all happy. They're relaxed.
Exactly. And it's really transformed my patient recovery. And, with that, you're not back to full activity. I don't want people to think that you're back to the gym in 2 days. You're not. That's where you still have to take the time off. But I just saw a patient today who I did a breast reduction on yesterday. And, she's not on any narcotics. She feels great. I said, yeah, if you feel up to it, she's a professional. I said, you can go home and get on your computer and do some work, get some billable hours in. She's like, yeah, I think I'm going to do that.
There we go.
I'm glad more and more surgeons are coming to this, and not just in plastic surgery. There's been a big trend within medicine, but within our specialty, I've been really trying to teach my colleagues, and many of them have been responsive to it. And it's I think it's been great. I know I'm giving up the secret sauce, but I'm okay with that. I don't need to meet McDonald's and have my secret sauce that I keep
the secret sauce
hidden.
And the next thing you're gonna see that guy on Instagram who tells the recipes from the secret recipes.
Right. Yeah. I'll stay ahead of that. Yeah. But I mean, it's worked well for McDonald's. I mean, they've kept that secret sauce under wraps for 60 years.
They totally
a Big
did.
Mac is a Big Mac.
They totally did. Well, that was my actual question. Why do you think there's more providers don't offer something like this? Because I feel like it's truly remarkable.
You know,
Do you feel like it's just timing that until we get there, or?
I think it's timing. I think there's a lot of inertia in medicine.
Mhm.
You do what you do and it works for you. And that's not true for everybody. I mean, I think there's a majority of surgeons who truly want to learn and get better. I was just in May at one of our major meetings in Vancouver, and just watching people listen to presenters and take notes and hearing them discuss, oh, I need to try that, and let me see if I can get my results better each time. But there are certain things people are just stuck on. And I think as surgeons, we tend to be technique people. We want to try this technique of a facelift. We want to try that technique of a breast lift. We want to try that fat grafting. And we don't think about the pharmacology as much and, the medicine side of it. And, maybe it's just breaking through on that, or some people are just like,
Yeah.
But for me, it's been great for my practice and it's been great for my patients.
Yeah, I totally agree. And I feel like maybe because paying attention recovery is as important as a technique in surgery, because the comfortability and how patients are recovering after surgery, that's the whole perspective that they have from the results and the whole process. Yeah, but
And it extends beyond surgery. I mean,
yeah.
we talk about some of the non-surgical stuff you brought up before, especially when you look at things like, facial rejuvenation procedures and, chemical peels,
Mhm.
lasers, or RF energy. There's still a healing process. And
Yeah.
we've gotten so much better. It's not just gooping Vaseline on someone's face. We have wonderful barrier treatments and topical anti-inflammatories and, little bits of steroid and stuff that have made the recovery process so much more comfortable, quicker in some ways, and safer, less complications than we used to have. So it all kind of flows together, and it's a trend. And we're talking about trends. This is
It
a
is.
trend.
It is.
Easier recoveries.
And I feel like it's another most common asked question before patients can't do anything. What about pain?
Mm-hmm.
How bad is the pain? So it's definitely a remarkable thing. And again, as I said, I preach to everybody. I truly do, because it makes a whole lot difference. It does. But also I wanted to say about the 3D, the picturing, sorry if I'm wrong.
The 3D imaging.
There you go. I think it's a fantastic technology that everybody has to have, because again, story of my life, my mom, she was extremely afraid of me doing any type of surgery. And I think she just had this perspective of, as we mentioned already and before, go big or go home. Mm-hmm. And that it's how it used to be done. Mm-hmm. And when I brought that picture and I said to her, okay, I'm doing it. I've been talking about this for 2 years. It's like, I'm doing it, and that's how it's going to look. And she looked at it. It's the first time she was like, okay. So that made a whole lot difference. She realized that it's not going to be the case. And it just, people are visual. People are absolutely visual. So the visual part and the pain part, I feel like two most important things, I would say, in the industry in general. Okay, so I think we only have like a couple questions left before we dive deep into some audience questions. Okay. But before that, let's see. Can you touch a bit on importance of the proper skincare routine with facial procedures? Why it's important to start the regimen before surgery and maintain afterwards?
Sure. So when we talk about facial rejuvenation in general, I think we have to look at a couple of different aspects, because there's no single treatment that fixes everything. The two most common things that we have to look at are position of tissues and the quality of the skin. Things that we talk about all the time that are, fillers and Botox have an absolute role. And, that's a whole nother discussion. But when we talk about the aging face, what we typically see is changes at the bony level, loss of volume of the bone in the midface, lengthening of the bone in the lower third of your face, which then allows your cheek tissues and the tissues around the jawline to sag. And that's where some of the surgical or non-surgical techniques are going to help reposition. But that doesn't change the skin. And what we have to remember about the skin is it's our largest organ in our body, and it is the organ in our body that takes the most abuse. Simply walking out of your house, your skin is taking abuse. Sun, pollutants, weather, cold, dry. And so we see changes in our skin, fine lines, loss of elasticity, breakdown of collagen, disorientation of collagen and elastin fibers in our skin, and pigmentary changes, accumulation of spots. And so when you do rejuvenation procedures and you lift those tissues into a more youthful place, if you're not addressing the skin at the same time, you still got 60-year-old skin on 45-year-old positioning. It doesn't look right, and it's not a full rejuvenation. So the combination of them is, again, like I said before, a 1 + 1 = 3. But we have a healing process. And in order to maintain the results, you need that skin to be healthy. You need that collagen and that elastin to be less broken, more organized. And so that will prolong your results. We're not going to stop the changes that are happening underneath, but we can lengthen the support structure on top. So we like to start all of our facial rejuvenation patients on skin care before surgery. Mm-hmm. And some of them will do, starter skin care stuff, whether it's, creams, lotions, salves, RF energy, even some laser treatments. And then afterwards, we may even do some big laser treatments to get the skin resurfaced. So it's essential, and it helps you to heal better. Unhealthy skin doesn't heal as well as healthy skin. It's just that simple.
Exactly. I'm going to cut it out, and I'm going to use it at my studio, just put it on the TV so it repeats itself all the time. It's extremely important. It's your investment using antioxidants, you protecting your skin with the SPF. It's two things that it's like your insurance, so it's extremely important. I completely agree with you. All right. And last question, hot topic of the day. What inspired you to choose plastic surgery as a specialty? And what advice would you give to medical students interested in this field?
Wow. I was not born a plastic surgeon. It was definitely a process. When I started medical school, I thought I was going to do something in the neurosciences because as an undergraduate, I loved neurophysiology, the working of the brain. And when I got to medical school, I immediately fell in love with surgery. And I knew I was going to be a surgeon at that point because I love the ability to fix something. Mm-hmm. Someone comes in with a broken bone, you fix it, it's done. Someone comes in with a blocked blood vessel, you unblock it or you bypass it, and yay, there's blood supply. Or someone comes in with a solid organ tumor, you cut it out, and yay, you fix them. I loved that. I loved the ability to, with my hands, solve something for a patient. But I hated deling with the aftercare for all those things.
The hand-holding.
It just wasn't my thing. I respect my colleagues so much, but I didn't like that aftercare. I didn't enjoy it until I went into the plastic surgery experience. And I had the honor of rotating with the plastic surgeons at the University of Michigan in my third year. And I did it for all the wrong reasons. I thought I was going to be a trauma surgeon. I did research with the trauma team. I loved it. Again, the ability to fix something. And the plastic surgery department was always known that they taught you how to sew. Mm-hmm. And so I said, I'm going to go hang out with Dr. Smith and his team because I'm going to come out and I'm going to start on a better foot than all the other general surgeons are going to, and I'm going to be a better surgeon because of it. And the second day I was on the rotation, I realized the patients I liked, and I liked the aftercare, and I loved the problems. I loved seeing something not only as it is, but what I wanted it to be. And it led me down. And that day, the second day on that rotation, I remember talking to them and saying, this is what I need to do. And that's what took me there. So it was a very fortunate experience for me. This was well before plastic surgery was a hot topic.
Mm-hmm.
It's before social media. This was in the mid 90s. This was 1997. And ever since, I never looked back. It was the best thing I ever did.
That's amazing.
But
You said that you were not born as a plastic
I was
surgeon,
not.
but I would argue that you speak so passionately about it.
Thank you.
Of course.
But for somebody who wants to go into plastic surgery, I would give two pieces of advice. Number one is make sure you're doing it for the right reason. When we are kids, everyone wants to be a firefighter or a princess.
Astronaut.
Or an astronaut. It's a good one, true. We all want to do these things because they're in your world. They're in your sight line as a child.
Mm-hmm.
If we stopped there, we would all be, first responders and princesses. But
Some still.
some still are. This is true. And God bless our first responders.
Yes.
I was an EMT in college and high school, and I still very special place in my heart for all of our first responders. Excuse me. But plastic surgery and being a plastic surgeon is so pop cultural right now that you need to make sure you're going into it for the right reasons, not just because the Kardashians or some other social media influencer says this is something you need to do. The other thing is, if you want to go into the specialty, you got to work your butt off. It is incredibly competitive.
Mm-hmm.
It is very hard. It is incredibly demanding, and it is a long journey. I did not start in practice until my early 30s.
Wow.
And that is normal.
Yeah.
That's how long it takes to get there.
Yeah.
I mean, you don't graduate high school and all of a sudden you're a plastic surgeon. You've got college, 4 years, typically medical school, 4 years, residency for 6 years, plus or minus a fellowship. You're talking 15 to plus years before you even start practicing. And then trust me, when you start practicing, you are just starting. So it is definitely a long road, and you have to be doing it for the right reasons. Otherwise, you're not going to make it through it. So, work your tail off, and you got to be completely committed. If you think you're going to go into this just to be a social media influencer, just go be a content creator. Don't just skip the rest of it and just go be a content creator.
Just stick there.
Right. And you need to do it for also the right reasons. Don't do it just because you want to make a lot of money and drive nice cars and have beautiful jewelry. Do it because you want to work with patients and recognize that it also can be challenging. People have expectations, and it's not all glamour. It's incredibly rewarding. I wouldn't trade it for anything. I am blessed that I have the opportunity to do this. But the reality is I could have made a lot more money in finance. I could have, done a lot of other things in my life, but I wouldn't give this up for the world.
That's a fantastic answer, Dr. Iteld. Thank you so much for saying that. And you're absolutely right. It's doing this for the right reason. Industry is growing tremendously, and I feel like it's just multiplying every year. But there are a lot of people going into it just because they feel like sense of income that will provide them, or because it's popular and things like that. But we all forget it's not going to last too long if you're not passionate about it, if you're not truly care about what you do, with results, what people you work with. Because it's what I always say. I'm in an industry, it is a beauty industry in general. It's extremely competitive, like extremely hard. But every time when the client walks in and they smile and you made their day a little better, That's what I'm there for.
Absolutely.
Yes.
Absolutely.
Okay. So to wrap things up, we only have a few audience questions.
Okay.
Okay. So let's see. First one is, how long is the recovery after mammoplasty?
So after breast augmentation, there are a couple of phases to the recovery.
Mhm.
So, I would say somebody who is doing non-physically demanding work, so somebody who works, off of a computer or other, platform like that,
Mhm.
you can be back to work in a few days.
Mhm.
Typically, you're on a couple of medicines. We want to just kind of wean those down, but a few days from that. Back to strenuous activity can be up to 3 to 4 weeks, especially for somebody who wants to get back to the gym and be fit, or if you work in an industry like that, it's going to be more like a 3 to 4 week recovery. But for patients who are, white collar professionals, for lack of a better term, a couple of days of downtime.
Okay. I can stand by that. It's exactly what I think it took me. Well, I'm an esthetician, so it took a week and a half. Week and a half, yeah. And I just went a little lighter than I usually do. But if I would be working from home, it would be maybe a couple of days steps. All right. So if I'm still nursing, do I have to completely wean off my child before undergoing the surgery?
Yeah, I think that's really important for a couple of reasons. First and foremost, if you're breastfeeding, your breasts are engorged.
Mm-hmm.
And so when we do our breast augmentation planning, we are trying to figure out where you want to be.
Mm-hmm.
Well, if you still have milk, your breast's going to be bigger. And then when you stop breastfeeding, you're going to be too small. And then guess who's paying for that bigger implant later? Not this guy. Okay. So that's very important. Also, we want to make sure that, when you're breastfeeding, you've got a baby's mouth on your breast, right? And the mouth is not sterile. So we want to decrease the risk of things like capsular contracture, which is the formation of scar tissue around the implant, which we believe has to do with bacteria. So for more than one reason, I think it's very important that you just kind of let your tissues get back to baseline. Typically, we will say about 3 months after you finish breastfeeding. Because to our moms out there, your breasts are still changing for a couple of months after you finish breastfeeding, is a good time to consider doing your surgery. The other piece of the puzzle for that is, where are you in your reproductive planning?
Mm-hmm.
So if you've had baby 1 and you and your partner are immediately going to try to have baby 2, I would say it's probably not the best time to do your breast aug. But if you're either done with kids or you're done for a while, then it's reasonable.
Mm-hmm. Beautiful answer. What is the typical cost of breast augmentation?
Oh, geez. Yahira, how much does a breast aug cost?
Okay.
Yeah, I mean, the price, nationally, prices are going to vary.
Uh-huh.
And, I'm not going to say I'm not ashamed. I'm not at the bottom of the price range. I'm, mid to upper.
No.
But, I would say, what are we about? 8 to 10? Yeah, about 8 to 10,000 in total. One of the things that's important though is, don't just chase the dollar. I mean, you can find, in Miami, you can find a, $39.50 breast augmentation.
I'm like scared.
Yeah, but I mean, you have to ask the question, who's doing it? Where are they getting their implants? What are their margins? Mm-hmm. And, recently in the news, we've had the issues with the fake Botox, right?
Yeah.
So, where does all that happen from? There's cost to do business. And, I'll circle back to the breast augmentation in a second, but these fake Botox. When I do Botox, when I inject, or my nurse Kimmy injects, we have costs that go to us. And just buying Botox from AbbVie costs us over $6 a unit. And, yes, there's some other products that are a little bit less, maybe $5 a unit. But the reality is somewhere in that $5 to $7 a unit cost to practice. Well, now I have to pay for my office. I have to pay for my malpractice. I have to pay for supplies. I have to pay for my staff.
Your education.
Forget my education. Forget that. Just running the business.
Yeah.
Right?
Yeah.
typical aesthetic practice, it's about 50 to 60% is overhead.
Mhm.
So now all of a sudden, before I even make a penny, you're at $12 to $13 a unit, or $10 to $13 a unit. So you have to be cutting something out somewhere to get your Botox for $7 a unit. Well, what's happening? People are buying it overseas.
Mhm. Mhm.
And a lot of the time that's happening because it's being done by practices that don't have a medical provider over them. So they can't buy it directly from the company. So they're buying it through Canada, which came from somewhere else. I don't know what's in that vial, right? But they're getting it for $3 or $4 a vial, so they can afford to do it. And then you get into situations like we've heard on the news where you're actually not injecting aesthetic concentrations, you're injecting industrial concentrations. You may be injecting 1,000 times or 10,000 times the dosage.
That's scary.
It's terrifying.
Yeah.
And there have been catastrophes because of it. So you need to do your research of where you're going, and don't just chase the dollar, because trust me, if you're going and you're getting your $39.50 breast augmentation, who's doing it? Where are those implants coming from? Who's doing your anesthesia? How is that facility being cleaned and run and instruments processed? We see a lot of scary things that happen. So I'm not saying always go buy the most expensive, but make sure that it makes sense. I mean, we were talking about handbags before. I'd be really concerned if somebody was selling me a $499 Louis Vuitton tote bag, right?
Absolutely.
Something's wrong here, okay?
Just a little.
Just a little. Either it fell off the back of a truck, okay? Or...
It doesn't say Louis Vuitton, it says Vuitton Louis.
Exactly. So, buyer beware on chasing the dollar.
Absolutely. It is scary, I one time got I get my Team J Botox. I do grind my teeth, but even getting in a professional facility, because it was a newer product, possibly it just spread a little differently, and I couldn't smile for 3 months. It was I mean, as a professional, I knew it was gonna wear off. I wasn't really happy about it, but it's okay. But now we're talking about injecting extreme high concentration. What can it do? It can create a huge amount of wrong things in your body. It's a drug. It's a surgery. It's your only body that you have. So to me, it's the topic that I get a little heated. Okay, so we have a couple more.
Okay.
I have diastasis recti and abdominal hernia. Can this be fixed at the same time?
Yeah. So for people who don't know, a diastasis recti means that the connective tissue between your six-pack muscles is weak and stretched. And most commonly, that's from pregnancy. There are other reasons, but that's the most common reason. It's not a hernia. A hernia means that there's actually a hole in those tissues that the internal contents can come up through. So if you have a diastasis, it's just like stretched out spandex, okay? As opposed to spandex that have a hole in the wrong place. You can imagine something falling through, okay?
That's a good example.
Hashtag guy problems.
Yeah.
Okay, so, okay, that being said, so if you have a small hernia, then yes, it's a very good time to fix it. And most of the time, those hernias are going to be in the middle, like the belly button or just above the belly button. And when you fix the diastasis, you're sewing the edges of the muscle back together again. So it's a double layer repair of the hernia. There are other types of hernias. If you've had previous surgery and you have a big giant hernia, or you have a hernia in the groin, those you probably aren't going to fix at the same time as a tummy tuck. But the smaller, more common ones in the middle, yeah, absolutely. In fact, I think I have one coming up later this month, right? Okay.
There we go.
Yeah.
Perfect. And the last one, does it make sense to invest? We kind of talked about it, but does it make sense to invest in skincare treatments, or should I just wait to get a facelift when needed?
No, start early and get your skin as good as possible.
Yeah.
The reality is our patients who start good skincare in their 20s and who start using sunscreen in their single digit years are going to age much better. And you will definitely put off when you have to have surgery. And when you do have it, you will be in a better position to have a fantastic result. Our sunbathing babies, and I am old enough to remember mirrors on the chest.
Boiled up, put a screen on it.
Yep. Baby oil.
Yeah.
And, I remember when I was a kid, I was really fancy. I put on SPF 4.
Wow.
Yeah, because I wanted a tan. Yeah, I mean, that's just going to age you prematurely, and you're going to get, leather face, and it's just not a good look. And some of it's irreversible.
Yeah.
So, to our, Gen A's or Gen Alphas who are listening and our, Gen Z's,
Yeah.
please, if you're not doing anything else, take care of your skin. Put your sunscreen on every morning. Plug in with a skincare professional, and work with them. And it doesn't have to even be expensive at that point. Just a little bit of skincare goes a long way to keeping you looking youthful for decades to come.
100%. I always tell it's cheaper to start earlier. Mm-hmm. It is. And especially, yes, I've got clients, and I'm sure you've had patients when come in and they're 50s, 60s, and just fix it. Mm-hmm. Just fix it. I mean, we can put a lot of effort and improve a lot of things, but you're not going to get the same results as the client or patient that started in their 20s and their 30s, taking care of regularly of their skin and doing regular procedure in the skin elasticity improvement, skin tightening, or just maintaining and protecting with the SPF. So it's been wonderful, Dr. Iteld. It's really been an honor, and I'm thankful for you being here. I think we discussed a lot of fantastic topics, and I hope chatting with you soon again.
Thank you so much for having me. It's an honor, and keep up the great work getting the messages out.
Thank you. Thank you so much.